So we've told you about the vaccines, the candidates and how they work. What about the prices? What will these vaccines cost? This factor alone could very well decide which vaccine you might end up getting. Vaccine companies realize this, so they are willing to competitively price the vaccine. Our next report tells you more.
A vaccine. For 11 months now, the world has been waiting for one. It is the ultimate weapon to defeat the Wuhan virus. But will you be able to afford it? Recent breakthroughs have heightened expectations. If the trials go well, the world might end up getting more than one vaccine. That too at affordable prices. Some estimates and advance orders provide valuable insights on how each of these vials could be priced. The Oxford University AstraZeneca shot could be the cheapest vaccine. They are promising to sell the vaccine at cost price to developing countries. In India, the Oxford vaccine could cost a maximum of 1,000 rupees or around $13 if purchased from the pharmacy. Buying a single shot from the private market could cost anywhere between 500 to 600 rupees or nearly $7 to $8. The Indian government should be able to procure it for much less. According to one report, the Indian government could get it for 250 to 300 rupees or around $3 to $4.
Governments will be purchasing this vaccine and making it available to the populations of those countries. But also Gavi, the Global Alliance for Vaccines and Immunisation, will be supplied with vaccine, and they can make vaccine available to low-income countries. The vaccine is not very expensive to manufacture, and also no profit will be made during the pandemic period, which also helps to keep the price of this vaccine very low.
In comparison, the other shots could be expensive, like the Pfizer vaccine. Reportedly, one dose of this vaccine could cost $20. This is the price that the US government has struck with Pfizer to procure the vaccine. Those who do procure this vaccine will face an added cost. The Pfizer vaccine needs to be stored in special ultra-cold storage at minus 70 degrees Celsius temperatures. Pfizer has already moved the US regulators for emergency authorization. Similarly, Moderna is selling its shot at $15 to the US government. The company plans to roll out the vaccine first in the United States.
We hope to have about 20 million doses of the vaccine by the end of this year, by the end of the calendar year. And we're looking forward to making about 500 million to 1 billion doses next year. But that is going to be a 24/7 operation.
The makers of Sputnik V plan to give the American pharma giants a run for their money. They plan to sell one shot at $10. Sputnik V is a 2-dose vaccine. Its makers now claim that it has an efficacy of 95%. The vaccine is undergoing trials in India and Brazil. The Russian government has sealed agreements to produce the Sputnik V in India.
BRICS members were able to react quickly and take concrete measures to combat the pandemic. I would like to note that the Russian Direct Investment Fund has concluded agreements with Indian and Brazilian partners to conduct clinical trials of Sputnik V vaccine, as well as with pharmaceutical companies in China and India to open centers for the production of our vaccine in these countries, not only for their own needs but also for third parties.
All these vaccine candidates could be made available by early 2021. The early supplies will be limited, but the vaccine makers are promising to ramp up production as soon as they get the nod from the regulators. Bureau Report, WION World is One.